Hello, my name's Roger Harrison and I'm one of the tutors on the MPH-MRes course here at the University of Manchester. Today I'm going to give a brief introduction to one of the core units, evidence-based practice. Some of you may already have come across terms such as evidence-based practice, evidence-based medicine or even evidence-based policy. And I expect some of you will have received some previous training in some of the areas of this work and introduced it into your daily work. On this course we aim to provide students with both the theoretical and the practical understanding of some of the main principles of evidence-based practice. The course has two distinct but interrelated sections. The first half of the course focuses on the more practical aspects of evidence-based practice. And some of you are likely to be familiar with some of these components. And in particular, we introduce skills in searching for, critically appraising, and then using or applying evidence from published studies in a more traditional hierarchical fashion. Yet in the second half of the course, we literally blow up our whole belief in the whole principles of evidence-based practice and how so often it has been used in the past. We in fact question the suitability of these rigid and hierarchical models when the context or the life situations which many of you are already working in are far more complex and don't necessarily fit into neat structures. So what can we do about this? Well, we're not saying that we should abandon the underlying principles of evidence-based practice, but we do think that we need to bring in different approaches to using a wider evidence base and the idea of problem-based practice. EBP usually runs in the first semester of the academic year. It is a core module and it needs to be taken and successfully passed by all registered students. The assessment process consists of two assignments, a midterm and a final assignment. Both of the assignments assess your practical and theoretical understanding of the material that we have covered on the course. Students taking this course have often reflected positively on the teaching methods and the material covered across the 10 units, saying that it has helped them in their daily work and others in their future career aspirations. It is both applicable for clinicians and practitioners working with individual people and patients as it is for policymakers at a more strategic level.